Welcome to Issues and Answers with your host Diane Kinderwater. Issues and Answers is presented as a public service to inform, educate, and better the lives of New Mexicans. And now, Issues and Answers with your host Diane Kinderwater.
Welcome to the program. I'm Diane Kinderwater. On the show today, we're going to discuss hole in the heart. Well, what we're going to find is perhaps a hole in the system, or many holes in the system. That is why the founders of Hole in the Heart founded this organization. It's a nonprofit here in New Mexico, and we're going to discuss Hole in the Heart with the co-founders and why they developed this organization. It's to help you to bring awareness that 1 in 100 children born have congenital heart defects. And guess what? The medical field may not even know this. The parents know something's wrong, but the medical field doesn't. So we have Hole in the Heart to help bring awareness, partnership, and advocate for the best care for these children. So this program is going to be a program of hope, and that's what's good about it. So you don't have the distress that other families have experienced because there's a hole in the system. We'll be back with Hole in the Heart right after this.
Hey America, now there's a place where we can join our voice, Real America's Voice. Real America's Voice is coming to a town near you with a grassroots approach, bringing the real voice of America together. Real America's Voice is growing our family of networks across the country, and soon you could be part of that change. Download the Real America's Voice app and join other Americans just like you across the country, coming together for real.
Welcome back to the program. Again, this is a story of hope. It came from a lot of distress and PTSD and a lot of angst and anxiousness and anxiety and everything you can imagine if you find out that your child has a congenital heart defect, something that you believe is wrong with your child, but you can't convince the medical field to know, to look for it, to find out what's wrong. So you have to be your best advocate and work hard. Well, this is what the family that I'm going to introduce you to today did. For 15 years, they fought on behalf of their child to make sure the doctors found out what was wrong, and they found out what was wrong. But it took 15 years, and now you developed your own organization. Sandra Sanchez Fahrlender is the co-founder of Hole in the Heart, and Bob Fahrlender, thank you so much for being a part of the program. Co-founder as well, husband and wife, and the proud parents of 2 healthy boys.
Healthy now, we hope. Knock on wood.
Don't we all knock on wood about our children? But you have quite a story you're going to share. But Bob, you started this organization a few years ago for 3 main reasons.
Yeah, we found many disparities in the continuity of care. That's really the impetus of our journey, right? But we have 3 missions. One is to promote awareness. The second is to create partnerships. And lastly, it's to advocate for best practices in the detection and diagnosis of congenital heart defects, mostly in our youth.
And congenital heart defects, I believe, Sandra, affect 1 out of every 100 children born.
Yes.
And what type of defects are we talking about, Sandra?
Well, defects are the structural, the way the heart is made. By 30 days, the heart is formed in a newborn. So sometimes these hearts aren't fully formed correctly. And this is why. And CHDs are the #1 newborn defect in the world.
Congenital heart defects are the #1 defect with the heart. Okay.
Birth defect of all birth defects. It's the #1 newborn defect in the world, but yet the most neglected. And
I think that's where the disparity comes from, Bob. I mean, it doesn't seem, it's the #1, yet it's not detected.
Not all signs lead directly to the heart sometimes, right? Some of the things we've learned on our journey is the most common symptom of a child that has a undiscovered congenital heart defect would be the early onset of asthma and allergies. Sounds simple, doesn't it? Normally you go to the store, you buy some Benadryl, you buy some cough medicine, and you might be treating your 2, 3, 4, 5-year-old for colds, allergies. But what that really is failure of your immune system to form properly, so a lack of oxygen. So it's essentially a plumbing problem. Now, we know that now, but our experience in the medical community was treating the symptom, not really the underlying cause. So that masked a lot of
That's
things.
when they
right?
like to give drugs, and more drugs
It's
to mask the symptoms and
Western
not fight.
medicine, right? That's how they're trained.
And I think also there just isn't a lot of research and development for congenital heart defects. So yes, not all fault on doctors and providers. There's just not a lot of education.
But it's the
There's
number
not a
one
lot-
defect.
Right.
So but there's still a lot
not.
of research. There's not research.
A really frightening fact that we discovered when we went on this journey with our nonprofit is that CHDs are more prevalent, 60 times more prevalent than childhood cancer. Also, more
60 times as much, but of course we have money going to research for childhood cancer.
right.
Correct.
Also, another fact which leaps off of that is twice as many children will die from a congenital heart defect than from all childhood cancers combined.
So why isn't someone other than you two out there shouting to the heavens?
And that's the thing is this is what we're doing. We're promoting
Can you shout?
awareness.
Are you shouting
We're
here,
shouting
Sandra?
now.
You're shouting now.
And you know, we really have to, we look at it as we're going to do as much as we can until a door opens, until somebody can come along and say, hey, we need to make this something. But we're going to do it until then because
Nobody else is doing it.
well, CHD is for the rest of our lives because of our son.
And we're going to tell about his story.
Yeah.
Before we do, Bob, again, tell me the types of congenital heart defects we're talking about.
So you're talking
There
about
is.
any structural deformity of the heart, normally formed in the mother's womb, as Sandra said, right? The heart is formed in the mother's womb 30 days after conception, after being conceived, right? So early in the pregnancy. Now we have technology that it's fetal ultrasound that can detect much of that, but still 2/3 of kids that have congenital heart defects aren't discovered till after birth, if at all.
But you're saying with ultrasound they could maybe discover it.
That's the
So
problem.
what types of problem? We were going to talk about a hole
Yep.
in the heart, but other than your child had a hole in the heart for 15 years. Other than that, what types of defects?
So there's 4 chambers of the heart with valves and all kinds of things in there, right? So our son had an atrial septal defect. So ventricle is the bottom part of the heart, the V, A is the top. So the left and right chambers, he had a dime-sized hole between those 2 chambers. So if you follow the way the blood flows through the heart, kind of in a U shape, to simplify it,
Thank you for that simplification, Bob.
the clean blood and the dirty blood kept mixing. So the oxygen content of the blood that was being circulated through his body was not enough, obviously. So that's one example, right? You could have a hole between the chambers. You could have a valvular disorder where your valves don't open and shut properly. You could have thickening of the walls. There's lots of different kinds of structural defects, yes.
There's
Okay.
approximately 19.
Yep.
Okay, 19
Congenital
different
heart
Right.
defects.
19 defects.
Right.
Childhood
And-
defects. As adults get older, there can be more defects.
And a child can have multiple.
Oh,
So
Multiple holes, yeah.
multiple holes, multiple defects, different kinds. So most children, 25% of children who are diagnosed with a CHD will have one life-saving surgery during their lifetime.
Some other things we learned on our journey is about a quarter, 25% of the population, has a hole in their heart. But
right now. Right now.
just on average.
1, 2, 3, 4. We have 4.
Some may not be symptomatic, okay, or at least overtly symptomatic. Now what we've learned is better to check and see versus dismiss it. But
Sure.
we were told it was totally normal, asymptomatic, like I said, but
Let's talk about your journey now that we know a little
Yeah.
bit more about your organization, what your main priorities are with your organization, starting with mom and having a newborn baby, little son who is now, her baby's 20 years old, but a journey of 15 years of countless, well, you probably counted, I'm saying hundreds of doctor's appointments and such. Tell me a little bit about your son. And of course, he's wonderful, but the medical issues that you had, and doctors telling you it's normal, take some medicine.
Well, he was as a newborn, I mean, weeks into it, he started getting GERD, which, you know, a lot of babies get GERD, but
And that's what, a coffee,
that's
Reflux.
like reflux. He also was allergic to formula, so he couldn't take formula. We had to buy him a special kind of formula. He couldn't break down proteins appropriately. He would projectile vomit. He was sleeping
as a little baby.
Baby,
Okay.
like weeks old.
Okay.
You know, that's the way it started. Then we moved into, he had multiple upper respiratory infections, a lot of ear infections, tons of ear infections.
Which a lot of kids get.
A lot of kids get,
Okay.
A lot of respiratory pulmonary problems.
Respiratory
Right.
pulmonary.
At the age of 3, he contracted pneumonia and his lung collapsed.
Now that's a little
And
unusual at the age of 3.
So that kept us in the hospital quite a long time. And then from there, it started where he started having problems with his lungs. They were weak because they thought because of the pneumonia. So we started seeing a pulmonary specialist. And things just started adding a list.
Of course,
things
if they
started.
had pneumonia, maybe they were saying everything's related to the pneumonia.
Right.
You're
So we
thinking.
were always looking at this way instead of this way or that way.
When
so we
did
would
you
go,
think, Bob, there was something unusually wrong?
He didn't sleep more than about 45 minutes at a time for a newborn. So that was, we knew something was wrong. But actually he had a loss of hearing, what we thought was a loss of hearing. He had tubes put in his ears, he had his tonsils and adenoids removed, but less than a year old, we knew something wasn't right. Speech delays, all those learning disabilities started to come about, right?
And from a lack of oxygen
well,
to develop.
We thought, I mean,
I mean,
we
you
saw
didn't know at that time.
No,
No,
we
you didn't
thought
know
it was
that.
neurological because something else Sandra was about to say is he's about 4 years old when he started having seizures, what appeared to be seizures, right?
And what causes seizures usually?
well, what would happen is he would pass out, and then it looked like he was having a seizure at the end. So what we do know
like
now,
epilepsy, you think?
right?
Okay.
We thought
so-
it was neurological. We
that-
were told it was neurological.
Right. So then we went to then we went to that kind of doctor, that kind of specialist. And so we were always trying to take care of what was in front of us at the time.
Sure.
But we were never, we kept asking why, but they would say, well, he looks normal, he looks all right, go on your way. Tests are all normal. And that was the problem, is all the tests were normal. So we would go home and say, okay, maybe that was just something that happened, but it just kept happening.
The primary way that a newborn is diagnosed for congenital heart defects is through pulse oximetry, where they'll put a device on a finger and then on the opposite foot. And then you look for disparities, right? You're looking like of oxygen saturation through the body. So that you think that you're using polar opposites of your anatomy. And if there's a big disparity, somewhere in between there's a problem of circulation, of lots of things. But that's the first and primary thing they do. Second, they'll do an EKG. That's checking the electrical rhythms of the heart.
Okay.
And sometimes when they see an anomaly there, that leads to a structural defect, right?
So you had these tests done?
We had these tests done numerous times.
Oh, numerous times.
Numerous.
And what did they show, Bob?
Normal, all normal. We pushed to have an echocardiogram, and he had many of those. It wasn't until he was 15,
The
though.
EKG is when they put the
Leads,
leads,
the electrical
on.
leads. And
Okay.
echocardiogram's an ultrasound, right? There's a topical ultrasound, and they use sound wave technology to look for structural defects, the way the blood
They
flows
did that?
numerous times. That is those are the primary
Yeah.
methods of detecting. And the other, of course, is family history, right? So as we talk about promoting awareness here, we worked with the American Academy of Pediatrics on what are some simple questions you could ask your family, your kids, to help understand if they might have a congenital heart defect, right? So do you know those 4 off the top of your head, Sandra?
They're heart screen questions, and basically, the offhand, You put me on the
well,
spot.
Sure.
They're actually on our website, and we recently went out to UNM Welcome Back Days, and we provided these 4 heart screen questions to students, faculty, and staff to help them. If you answer
Don't they teach
yes,
Don't they teach that in medical school? Without Sandra and Bob going there and saying, you might be interested in asking these?
well, we went to the
Sure.
to the main campus.
Yeah.
What we do know is sudden cardiac arrest has risen among athletes and young people. This is the reason why we are going out. Because if they answer yes to any one of these 4 questions, yes to even one, we are encouraging them to see their primary care provider for a thorough heart screen.
The first question is, have you ever passed out, fainted unexpectedly? The second one is, do you have any kind of abnormalities with pain or your heart profoundly beating out of his chest through exercise? The other 2 is, do you have any family members younger than 50 that have an implantable device like a pacemaker? Or, and the last question is, do you have a relative that's passed away unexpectedly through a drowning, car wreck, something like that, right? So those are the 4 questions that the American Academy of Pediatrics helped to work with on all high school physicals. So another entity we worked with was New Mexico Activities Association, right? So if you have a child that plays sports or is in band or just goes to a public school, every year they have to have a school physical.
Yes.
Now, those 4 screening questions are being implemented into those physicals through our work with those entities.
Through your organization.
Yes. So we're touching a lot of people.
Thank you. I'm just shocked and dismayed this wasn't happening prior to your efforts.
The more we tell the story, the more people share with us their stories, the more we learn, and that's what we're about.
That's what you hear about Hole in the Heart, organized around 2019.
Right.
So you do say if you answer one of these 4, go to your primary care and get a complete heart evaluation, except your son had all these and it still didn't find anything.
Might have to do them multiple times. That's
Persistence
Persistence
is that
pays.
it, Bob?
Yes. And
I mean,
Quality.
and
Quality, yeah.
you got to advocate. And I know, the things that we think about in our journey and also here in the state of New Mexico, we don't want any family to go through what we did. We want to catch these congenital heart defects at a much younger age, at birth, preferably, right? But how do we do that? So we set up a CHD Echo program with Project Echo, which helps partner congenital heart defect experts with medical providers to help educate, mentor, and create a continuity of care for CH patients in the state of New Mexico. That is our main program right now, and it's our biggest program right now. And we ended our program in September. It was a seven session, once a month session, where we ended up educating 54 providers in 14 medical institutions throughout New Mexico. So for our first year, we're really proud of ourselves, and we worked really hard. So we want to keep going. We want to make sure that no other family goes through what we went through.
So we ended with your son growing up through his adolescence, as a childhood, bringing him to all these doctors, Bob. When finally, again, you advocated, you had all these tests. So still your organization is suggesting you be tested, but the test didn't show things, correct?
Right.
So what happened? I mean, they didn't show. I mean, you did have the test.
He was a freshman in high school. In 8th grade, he was a normal kid. He played 4 sports. He was in President's Honor Roll. He was in choir, music, band, you name it. Very active. Going into 9th grade, he wanted to play football. So we allowed it. 3 days into camp, he collapsed.
Yep. That's okay. But what a wonderful son to do all those things.
He's amazing.
He's amazing.
Absolutely.
To be in all those activities.
Yes.
We don't need football. Actually, my son was in football, and I didn't know enough not to have him in football because he got injured with a lifelong injury. That's what happens with,
Yeah.
sorry,
So-
that is what happens with football. And
Right.
mothers and fathers don't maybe know that happens.
You know,
so he,
with our son, I think the biggest thing is he wanted to be normal. He
Sounds like
he
he-
didn't want
right.
he didn't want to be,
Of course.
and I mean that's such a important age where you figure out who you are, and a lot of times you just want to be like everybody else,
Sure.
right? As a teenager.
but we have learned since then
Right.
kids shouldn't be playing football.
The biggest thing,
So
I mean, really? Well,
the biggest thing that he overcome was his learning disabilities. That was the most overtly thing you would see about him was his hearing, right? So he spent his whole youth learning how to overcome those disparities because it wasn't his ear, it was a neurological problem, right?
for the lack of the oxygen.
Well, because it was the way his brain processed all the input.
And
Right.
and also, we don't stop at just we're not stopping at just fighting to get that diagnosis. We also need to realize that there's some things that happen after the diagnosis with children with congenital heart defects. So they have developmental delays. They have problems with exercising. They
Right. Once you diagnose it, we hope
Right.
there's some
there's
kind
a
of
lot there.
care to do.
yes.
But with your
So-
son at 15, when he went out for football, day 3 collapsed. As we're hearing happening all the time,
So-
what happened then?
We went to the ER, and again, they traced it back to a neurological disorder, some seizures. Right? They did perform an EKG, a pulse ox, an echocardiogram, an MRI, 3T MRI study. So thorough diagnostic study, but it wasn't till, that was in August. It wasn't until the next May, after returning from Barrows Neurological Institute, that we asked for all the tests to be run again because all Barrows Neurological Institute was rule out a neurological cause to these symptoms.
And it ruled it out.
It ruled out a neurological cause, but didn't point to actually what it was. So it had to be somewhere between the heart and lungs, right?
Why?
Lack of oxygen. What we were told was those seizures were not epilepsy. It was called convulsive syncope. So when your brain's not getting enough oxygen, it's going to tell you to get down. Gravity. Get your head below your heart so you can have enough blood flow. So that's when he was passing out and going into seizures, convulsions, that's your body trying to bring oxygen to the brain. We went for 15 years. You know how many times we called the ambulance? Because
many
we thought
times?
these were seizures, several.
Lots.
Too many to count.
We spent a lot of time at UNM pediatric ER.
And all he had to do was put his head down to get the action. Okay. So in May, what happened then? May of when he was 15 or 16, what happened? in May?
We took him to
You had the Barrows neurological tests, showed
We
nothing.
were kind of, you got to think, we were so desperate for anything. We were chasing Lyme disease, we were chasing mold toxicity, checking his fillings in his mouth for like lead toxicity.
Boy, what great
we didn't
parents
know.
he had. Wow.
So we went back to pediatric cardiologists as one of the recommendations, one we'd seen before. But we
and
asked for
had the test done again in May.
Well, the cardiologist came in. She was a pediatric congenital cardiologist.
And
She came
and we only have a
in.
couple of minutes
Yeah.
left, so we have to get to the
Okay.
end of that story.
She came in. She ran a couple of tests. She said the EKG shows a little bleep, so let's run him down the hallway and do an echo. We said fine. We looked at each other and said we're probably going to be walking
go
out of
again.
here in a half an hour. They took him down. They did the test. She came back in, immediately came back in and said, well, folks, he has a hole in his heart. And the four of us were there. It was me and my husband and our son, and both our sons. And it felt like the air got sucked out of the room because it was a point where we finally could understand
We felt we
what
had
was
something.
going on with him.
But that was our own
Why do we,
interpretation.
and we have only 2
Yeah.
minutes left. My audience will be mad that we're not getting to the end of this. Why was that doctor able to find it and others could not?
We don't know.
Don't know. So
I think it was us, honestly, I think it was just us being persistent. It was us being persistent with our story about what was going on with him. It could have been that she was a congenital specialist, so she knew what she was looking for. There was a lot of things that we
So
were...
was he able to repair the heart?
Yeah, so she said it's 2 millimeter hole. 2 millimeter hole, simple 30-minute procedure. We put a cardioform device in the heart, no problem. We scheduled the procedure. It ended up being all day. It was actually a 10 millimeter hole, the size of a dime, right? And you wonder, how does a kid go 15 years without missing that? The point is, we found it, the surgery fixed it like a light switch. The next day we saw the mental fog lift. He had rosy cheeks. Tell the story what he did.
I spent
got a
the night
minute.
with him, okay, and he woke up and he said, "Mom," and I got to understand his mom's of kind of urgency. So I ran to his bed. I said, "What's wrong?" And he said, "There's tingling in the tips of my fingertips," which means oxygen was making their way to the tips.
He had color. He had.
We hear that
vibrancy.
now at this stage in life.
Yeah.
People who have had heart attacks get a stent in, and then they say, wow, you just had to,
Same.
they needed blood, oxygen to get
He
to
had
the
a
heart,
plumbing
same
problem.
thing.
Yeah, he had a plumbing problem. Yeah.
You gave us what you want people to know. How can they find out more information, Bob Fahrlender?
Hole
about
in the
that?
Heart, ASD.org. Look up Hole in the Heart. We're on Facebook.
We're on Instagram, we're on, it's not Twitter anymore, it's X. And just go to our website and look at all the wonderful work we're doing. But like with any other organization, we need help. We need support. We need board members. We need volunteers. And we also, of course, ask for donations in kind for us going out and doing this important work.
And how many volunteers do you have so far?
Oh, we've touched thousands of lives, but we have a board of directors, about 10 people that we work with.
It's a big job,
Yep.
but a rewarding job. Because why, Mom? You're giving these other mothers what?
We're giving them hope and encouragement, and we hope that, moms play an important role. We want them to be able to feel confident in advocating for their child.
That there could be an answer. And dads too, Bob Fahrlender.
Sometimes,
It sounds like you've done.
if I get
a heck of a lot.
permission, yes.
You've got a lot, Bob Fahrlender. Thank you so much. Sandra Sanchez
you.
Fahrlender, thank you so much for bringing this important information to our station and to our viewers. And best of luck to you and your family.
Thank you.
It makes me smile now. Appreciate you watching this program. I'm Diane Kinderwater. Make it a great week with your family. We'll see you next time. Thanks again. Bye-bye.
The New Mexico Modern Child Support Family Program works to benefit both parents for the purpose of improving children's lives. It provides the basics of child support, but goes further by helping parents step up to find better job opportunities that get them back on track to paying their monthly child support obligation. Find out how the Child Support Step Up program can help your modern family. Contact New Mexico Child Support today to learn more.
Issues and Answers with your host Diane Kinderwater is presented as a public service to inform, educate, and better the lives of New Mexicans. To comment on today's program or to purchase a copy of any Issues and Answers program, visit sunbroadcasting.org or call us at 505-345-1991.